I think the biggest factor is get organized and get going because the number of options that they have and the various idiosyncrasies of plans are quite a few. So do not wait. Many of us are procrastinators. So get yourself organized. And by that, I mean get a list of your medications and have it be accurate.
If you're in Medicare, being in the right Part D plan can make the difference between saving thousands of dollars or spending thousands of dollars on medications each year. With so many options, how do you know which plan is right for you? Well, today we'll break it all down. What to look for in a Part D plan, how pharmacy choices impact your costs, and the key steps to finding the best coverage for your prescriptions. Joining me to help us do all that is Katy Votava. She's the president of Good Care and the author of Making the Most of Medicare. Katy, welcome.
Thanks, Bob. A pleasure to be with you.
Pleasure to have you here. So, just by way of background, this is the fifth episode in the series of episodes in which we've helped viewers and listeners learn about the annual notice of change, Medicare's plan compare tool, Medicare Advantage plans, and now we're on to Part D plan. So, to kick things off, can you explain what a Part D plan is and why it's so important for beneficiaries to sign up for one, even if they aren't currently taking prescriptions?
Sure. Medicare Part D is a prescription drug coverage sponsored by Medicare at the federal level, but it's provided all over the country by private insurance. And the purpose of it is to cover prescription medications, which, believe it or not, 10 years ago or so, we had no prescription coverage in Medicare. So it's a relatively new type of coverage. And it comes in two different forms, many different choices, but categorically, it's either what we call a standalone drug plan, I mean, it's just the Part D prescription coverage, or it's often included in a Medicare Advantage plan. But the rules are the same for the plan, whether it's inside a Medicare Advantage plan or what we call a standalone drug plan. So everything we'll talk about today will pertain to both kinds of plans.
Right. And as we think about the year ahead, 2026, we're looking at many standalone plans being discontinued, and that there's a significantly higher rate of Medicare Advantage and drug plans being discontinued. What is someone supposed to do with their plan if it's discontinued?
Absolutely. We are seeing more plans being discontinued than we've ever seen before. So it's a big shift. Typically, we have some plans close all the time, but this is, I would put it in the massive category. Some companies are just getting out of the business, and some are really narrowing their offerings. And it's really scary when people get those notices and they don't understand. They often feel like they did something wrong. Maybe they went to the doctor too often or had medications too expensive. It has nothing to do with the person. It's a business choice by the company. So they have to carefully read their notice because, in addition to the other routine notices, they get a specific notice from an insurance company. Number one, that's being discontinued. Number two, they get some additional time and some other privileges in that notice. And it's important for them to check into that so they understand the opportunities they have. Because for some people, honestly, they can wind up with a better coverage than they had before.
Yeah. I just want to make mention of this fact before we get on to the other questions is you can have original Medicare, a standalone Part D plan, and a Medigap plan, but you can't
Right.
have a Medicare Advantage plan and a standalone Part D or a bundled Part D plan and a Medigap plan. Those two things don't mix, right? It's oil and water.
It is oil and water, but one thing that does for people whose plans, Medicare Advantage plans, are being discontinued, they have the opportunity, if they want, not only to pick up a standalone drug plan, they can also, usually on their notice, they get a guaranteed issue period for Medigap. In many states, it's very difficult, if not impossible, to pick up a Medigap plan once you have been in your Medicare Advantage plan for very long. So for some people who have been actually kind of limited in those options, it's an opportunity for them to get into that Medigap plus a D, or at least if their plans canceled, get a new Medicare Advantage plan.
Yeah, that's great to know. So we know, you know, that many people are tempted to pick the Part D plan with the lowest monthly premium, but from your perspective, that's often a mistake.
Oh, absolutely. And the data shows that 95% of people in Medicare are overspending. And that's horrifying because people have tight budgets. And how they do that is, you're right, they pick on premium, not on benefit. So with a prescription drug plan, if you pick a plan because it's the cheapest plan, it may not cover all your medications as best as possible. And then you actually wind up spending more in total out of pocket. So it's worth doing your homework.
Yeah. So when you think about their homework, what is the biggest factor or factors that people should consider when comparing Part D plans?
Uh, Honestly, I think the biggest factor is get organized and get going, because the number of options that they have and the various idiosyncrasies of plans are quite a few. So do not wait. Many of us are procrastinators. So get yourself organized. And by that, I mean get a list of your medications and have it be accurate. Many of us talk about a medication and use a brand name to say, I'm on XYZ, but you're really not. You're on a generic. So get your medications very specifically, get them organized now, because you'll be able to start you can start looking at new plan information now, but you can start enrolling in new plans in mid-October. But for a lot of people, it's going to take them time to pull that information together. So I think that's the most important thing, to be honest with you. And then go do it and find help when you need help.
So when folks are familiar with the Inflation Reduction Act, which said that their covered drugs would be capped at $2,100, and it's really important that my understanding is that some insurance companies are moving drugs that once were covered to be not covered. And so folks may find that the drug that they thought would come into the under the cap may not be
Yeah.
there in their new plan. Is that fair to say?
It is accurate to say, but don't stop when you're told something isn't covered. It's always been true that some medications are not routinely covered on a formulary. And typically they're the ones that are more expensive, and they really they want specific medical necessity documentation. So people are going to need to apply for something called a formulary exception, an exception to that drug list for your plan, because you have these various health problems. And that is something people will have to pursue more this year than in the past. Physicians and doctors' offices are used to filling out the paperwork. It's a pain in the neck, to be honest with you. And community pharmacists can be very helpful to help people figure that out. But I've had many people, when they say, well, my drug isn't covered, it's like their first offer. Yes, it's not covered today. Will it be covered for you next week when that medical necessity paperwork is in and approved? And there's a level beyond that of appeal. And there's also something else, is when you transition from one plan to another, they have to give you what's called a transition fill. So if you're on something, the first month, they have to cover it whether they like it or not. And so some people are surprised when they pick up their drugs in January and they go to get them in February, and that's when they find out they're not covered. And they say, wait a minute, you filled it last month. So plan ahead for those types of things. And I know it's a pain in the neck, but if you plan ahead, at least the pain in your neck will be more limited than if you didn't figure it out ahead of time.
Yeah. Now we know that the government has negotiated prices for some of the more popular drugs for this year and the years to come. Will
Mhm.
that come into consideration as people think about what drugs are covered under the formulary?
So the list of medications that the government has already negotiated are actually relatively narrow. But one of the more common ones is insulin. And so if you're on insulin, it's $35 and that's what it's going to be. But a lot of people are on insulin and they get it through a delivery system like an injector pen. Those are not $35 a month. So you have to understand the differences there. So yes, it can come into play, but not all the time, and not actually on a hugely wide variety of medications so far.
Yeah. And then the other thing, people are familiar with these terms, but may not know how they work, copays and coinsurance. Do they have to worry about that when they're selecting a Part D plan?
Yes, they do need to know the difference between a copay is a flat fee. Could be $20, you pick something up. A co-insurance is a percentage. And you're going to see that in the higher tier medications where a person have to pay 50%, 30%, or whatever the percentage may be. So there's a big difference there. And a percentage on a copay on a more expensive medication is going to be more money than if it were a copay. Also, you
So
can Well,
go ahead.
one thing about the tiers and the copays and the coinsurance is people can apply for a tier reduction, so that if you have something that's in a more expensive tier, you can apply to have it come down to a lower tier. Honestly, people are not as successful as with that as I would like for them to be, but it is something to consider.
Yeah. Then in terms of coverage rules, things like prior authorization and step therapy, these are things
Mm-hmm.
that people need to know about as well.
Yeah, there's a lot of lingo here. And honestly, though, once you kind of get the hang of it and go through it a little bit, find someone in your family or go to the SHIP people who there are the volunteers all over the United States. They understand this kind of stuff. But step therapy may be required. And again, that'll be listed in the information on the Medicare.gov shopping site. So, step therapy means you've got to take step one before you can take step two. That's often done with expensive medications. And people will say, well, I already took that medication before and I can't tolerate it. That's fine. So there you go ahead and put that paperwork in right away. It doesn't mean you have to go back and take something that's going to make you sick or give you a side effect. It means that your doctor has to do this paperwork to say, we're not going to do step therapy because XYZ criteria on the clinical end. So there's step therapy, and the other one you mentioned is quantity limits. Many times they will say you can only get this filled once a month, as opposed to a lot of people would like medications every 3 months. Again, it's with more expensive medications, and you just have to work that into your routine. And seldom is it, I don't see people needing to appeal for that. Just plan it into your schedule. And sometimes when it is that way too, you might get a longer fill on something if the company has mail order delivery through their own system. Sometimes they will give you 60 days instead of 30 days, even when if you went to your pharmacy, you can only get 30 days. So look at the differences in whether you pick up your prescriptions, whether you get them by mail through the actual insurance company.
Yeah. Katie, we're going to take a short break. And when we come back, we're going to talk with you about how to pick the right pharmacy for your Part D plan. So don't go away. Welcome back to Decoding Retirement. I'm speaking with Katy Votava. She is the president of Good Care. Um, Katie, I promised folks that we would talk about how to pick the right pharmacy. So beneficiaries, when they go on the Medicare Plan Compare tool, that they are able to see various pharmacies. Some of them are preferred, and some of them are what might be described as standard. Some of them are in network, some of them not. What do people need to know about figuring all that out?
Yes, you really need to think about your life and your lifestyle to begin with. Do I stay in one place? Do I travel a lot? Am I a snowbird? Because you're going to want to include pharmacies wherever you're going to be. And it is easy to plug them in on the Medicare shopping site. That's why I call it the Medicare.gov. And they just have you ask and click your stuff in, and you can pick them out. And right there and then you will see, are they in network? Are they not covered at all, which would be out of network? Are they standard? If they're preferred, you will get better pricing with those pharmacies than if it's standard. And certainly if they're not in network at all, you won't get any coverage. The other thing to include in your search I recommend is clicking the mail order button, because you're not going to look at mail order for a particular pharmacy. You're gonna look at mail order through the insurance company and who they contract with. So that's yet another outlet. And you might think that prescriptions through the mail are more economical. They're not always.
So we've talked about the Medicare Plan Compare or Medicare Shopper tool as you've described
Mhm.
in a previous episode. But when you think about someone using the tool specifically for Part D, walk us through your checklist. So should they look at their formulary first, and then what tier the drug is in, and then what pharmacies are available to them?
I think first they should put their medication list together so they have all the information. Go into My Medicare, make sure your list is updated. And if you're new to Medicare, it won't be there, but it'll populate for next year. Then, if it's not there, you have to hand enter it. So do that first. And then it will ask you pharmacies. I'd say put all that in first because it will run the comparison more automatically for you. So then, once you put your data in, then look at what is going to be covered. Yes, no. If it's not covered, you want to compare plans. You want the most medications covered as possible. And then what will the price be? Because they'll tell you if it's a tier one or a tier three. Now you have to click around to various pages in that shopping site. One thing that I have found in that tool these days, though, is while there is a new cap of $2,100 for 2026, the Medicare shopping site, for some reason, doesn't have that programmed in there. So you might see that your medications are going to cost you 12 grand. They will not. And so my next step from that shopping site has always been do your first pass looking at the shopping site, then find the best coverage that you can with going to save the most money and have most of your medications covered with the fewest hassles. Then go to the company website because you want to double check that the information's up to date. Sometimes it's not, most of the time it is. So you want to double check that. And I have found just the information's only been up for a couple days that so far the company sites are showing you the more accurate price, including the cap, than the Medicare site is doing.
Yeah. You mentioned that you should enter all the medications you're on presently. Obviously, during the year, you may have to go on new medications. Does that impact the decision making at all, or is it too hypothetical?
People often ask that question and how I address it because it's important. It makes people nervous. And none of us know what we're going to need tomorrow. And so the thing is to realize that a couple of things. Any medication that you are given, they should fill for at least 30 days while you are asking for a formulary exception. And then if you are declined, most of them for good clinical reason are granted. Just most people don't understand and don't pursue it. So ask for a formulary exception. If you're declined, it's medication you really need, there's no alternative, then you must do an appeal. And most people do win there and make the pharmacist and whether it's your physician's office or oftentimes there's one person in a practice that specializes in this and make them your friend.
Mm.
And
So
then you
some
can get
people,
those things covered.
okay. So some people might have a spouse who works for an employer and they're on that employer plan, or maybe they have a former employer that offers health insurance. And one of the things that
Yeah.
they need to consider is whether that plan offers creditable coverage. And that's probably a term that doesn't roll off everyone's tongue, nor do they know what it means. So walk us through that.
Creditable coverage from Medicare prescription drug means that the benefit in the other plan is equal to or better than what you can get in Medicare Part D. And the easiest way to find that out is every insurance that people have probably overlooked it. When you get your annual enrollment packet in the fall from that company, they'll have a letter just saying it's Medicare creditable or not. Most of them are now. It used to be that some were not. I haven't seen one that's not creditable, but just look for that piece of paper. And if you have it, you're good. If it isn't creditable and you're Medicare eligible, that's a problem because you are technically not covered for Medicare D and potentially in a penalty position.
Yeah. So if you learn that it's not creditable coverage, and you're only on Medicare, say Part A, you should immediately sign up for Part B or Part C and a Part D, right? At least you'd have a enrollment period if you find out that you're not covered.
Yes, you should, because the penalty is 1% per month for every month you don't have coverage. The average person who doesn't have a Medicare D has somehow figured this out after 3 years, and they have a 36% increase for their lifetime in Medicare D premiums. And that can be
Yeah.
avoided by just checking for that
I mean,
paper.
in your experience, people who are exposed to this late enrollment penalty are probably exposed to a Medicare Part B late enrollment penalty as well.
Often, oftentimes.
Yeah. So
And
they're
so you get the
paying
double
two
whammy.
penalties.
You're paying 2 penalties, and if it's a married couple, it's often both of them paying those penalties. So it adds up to a few $1,000s a year for the rest of your life.
Yeah, and there's no way to appeal that per se, right?
With rare exception, there are rare exceptions, people were not able to do it for various reasons. There is one for if you were in a disaster zone. If you were in a FEMA declared disaster zone and you couldn't get to do your application for various things in the right way, whether it's you or your caregiver, that would be a reason to appeal to say, hey, no way could I do it because I was in a disaster area. There aren't that many of
Yeah.
those, for most of us, most of the time, but there are a couple of exceptions. But generally speaking, no. And that's often one that I can't get people out of. If you do it right up front, fine. But if
Yeah.
it's not followed through properly, and also people get well-meaning but bad advice about, particularly when it comes to COBRA, which is a whole nother thing about how Medicare works with COBRA or how it doesn't. So be very careful about that circumstance.
Yeah. So, for a listener who has reviewed their ANOC, maybe they've used a plan compare tool, but they
Mm.
still feel overwhelmed by all these choices. What's the single most important piece of advice you can offer those before open enrollment ends?
I think get on the list now to talk to a SHIP advisor. They're in every area office on aging all around the country. Go to eldercare.gov, and now they changed the link, but they link you, and you can find by zip code who you can talk to. But do it soon because most of them are volunteers and their slots fill up quickly. Also, all around the country, whether it's senior centers or libraries, they have information sessions. And go check those out too, because and bring your bag with your medications right there and then. And many times they will be able to plug them in and help you. Another thing can be a big help is local pharmacies. Many of them are doing searches now too, and they may find a plan that sends you to another pharmacy, but they already have your information, and that can be a great tool.
Yeah. It seems like the overriding theme of all the episodes we've done on Medicare's open enrollment period is that it's hard work, and you should know that at the front end, but
Right.
don't shy away from doing the work because if you don't, it could cost you thousands. And if you do need help, like you said, go to a Shine or SHIP representative who is unbiased
Right.
and has been trained to help you in these sort of things.
Yeah, but you know what I do say to give people encouragement? If you can shop online for shoes, you can learn to shop for Medicare. You just have to learn some of the features of the plan like you learn the features of your shoes.
All right, so the next time I go on Medicare's plan compare, I'm gonna think I'm buying a pair of new, tennis sneakers or something like that. So
That well, if you're
that's
able to
helpful,
pick
Katie.
through all the choices out there, you can figure it out.
Well well, that's hopeful. Thank you for that. So, Katie, this wraps up, this episode of Decoding Retirement. We can't thank you enough for sharing your knowledge and wisdom with our listeners and viewers. It's greatly appreciated. Thank you.
Well, my pleasure and good luck to everyone.
Thank you. So that wraps up this episode of Decoding Retirement. We hope we provided you with some actionable advice to help you pick the best plan during Medicare's open enrollment season. And as a reminder, we've got one more episode in this series in which we plan to tell you about Medicare's dirty little secrets. So be sure to subscribe to Decoding Retirement wherever you listen to podcasts so that you won't miss that episode or any episode for that matter.
This content was not intended to be financial advice and should not be used as a substitute for professional financial services.